What is left-sided heart failure? Our heart has two main sides, the right and the left, each with its own vital role. Left-sided heart failure occurs when the part of the heart responsible for pumping oxygen-rich blood to the rest of the body can no longer function properly. When the left side weakens, blood fails to move forward efficiently and backs up into the lungs instead. The result? Shortness of breath, especially when lying down or during activity, coughing, and extreme fatigue. Left-sided heart failure is one of the most common types of heart failure, and if diagnosed early, it can be managed and treated effectively. Pathophysiology of left-sided heart failure. Elderly man with symptoms. This image shows an elderly man with a concerned expression, sweating and appearing fatigued, representing a patient with left-sided heart failure. Common symptoms include shortness of breath, fatigue, persistent cough, sweating and anxiety, difficulty lying flat, orthopnea, decreased pumping ability. This illustration shows a weakened left ventricle which is unable to pump blood effectively to the body. Consequences: reduced tissue perfusion, low physical endurance. Blood backs up behind the left heart. Blood backup. When the left ventricle fails to eject blood properly, it leads to a backup of blood in the lungs and pulmonary veins. Effects: increased pulmonary pressure, impaired oxygen exchange, development of respiratory symptoms, fluid in the lungs, pulmonary edema. Fluid leaks from overloaded blood vessels into lung tissues, shown as droplets in the lungs. This condition is called pulmonary edema. Consequences: severe shortness of breath, nighttime or productive cough, frothy or pink tinct sputum, reduced oxygen delivery to the body. Main symptoms: shortness of breath. When the left ventricle cannot pump blood efficiently, it causes blood to back up into the lungs. This leads to increased pressure in pulmonary capillaries and fluid leakage into lung tissues, making the patient feel like they can't breathe, especially during physical activity or while lying down. Cough. Fluid accumulation in the lungs can irritate the airways, causing a persistent dry cough or a cough with frothy, sometimes pink tinct sputum. This symptom typically worsens at night or when lying flat. Edema. As heart failure progresses, poor circulation causes fluid to build up in the lower extremities, especially the ankles and legs, leading to swelling or edema. Pressing on the swollen area may leave a temporary indentation. Chest pressure or discomfort. Though not a classic symptom, patients may feel tightness or heaviness in the chest due to the heart and lungs being under strain. This is often accompanied by difficulty breathing and anxiety. Excessive sweating and anxious appearance. As the body tries to compensate for reduced blood flow, the sympathetic nervous system is activated, increasing heart rate and causing profuse sweating. Patients may appear pale, sweaty, or anxious, even at rest. Orthopnea, difficulty breathing while lying flat. Patients often cannot lie flat due to worsening fluid buildup in the lungs. They may need to sleep in a semi-upright position with multiple pillows or remain seated to breathe more easily. Causes of left-sided heart failure. Hypertension, high blood pressure. Chronic high blood pressure forces the heart to work harder to pump blood against increased resistance. Over time, this leads to left ventricular hypertrophy, thickening of the heart muscle, reducing its efficiency. Eventually, the overworked heart weakens, resulting in left-sided heart failure. Coronary artery disease. CAD occurs when the coronary arteries become narrowed or blocked due to plaque buildup, atherosclerosis. This limits blood flow to the heart muscle, reducing oxygen supply. The weakened heart muscle loses its ability to pump effectively, contributing to heart failure, particularly on the left side. Heart attack. A heart attack happens when a coronary artery is completely blocked, causing cell death in part of the heart muscle. If the left ventricle is affected, it compromises the heart's pumping ability. This loss of function can lead directly to left-sided heart failure. Valvular heart disease. Problems with the mitral or aortic valves, such as stenosis or regurgitation, can place extra strain on the left ventricle. The heart may struggle to maintain proper blood flow, eventually leading to reduced function. For example, aortic regurgitation causes volume overload in the left ventricle, which over time contributes to heart failure. Heart failure care. Medications. Take prescribed medications regularly, such as diuretics to reduce fluid buildup, ACE inhibitors or ARBs to lower blood pressure and improve heart function, beta blockers to reduce the workload on the heart. Always follow your doctor's instructions and never skip doses. Fluid restriction. Limiting fluid intake helps prevent fluid overload in the lungs and legs. Typically, a daily fluid limit of 1.5 to 2 liters is recommended. This includes all fluids: water, tea, coffee, soups, etc. Weight monitoring. A sudden weight gain, for example, more than 2 kilograms in a few days, can indicate fluid retention. Patients should weigh themselves daily in the morning after using the restroom and before breakfast. This helps detect early signs of worsening heart failure. Healthy diet. Follow a low-sodium diet, less than 2 grams per day, to prevent water retention. Eat foods rich in potassium, vegetables, fruits, whole grains, and lean proteins like fish. Avoid processed, salty, and high-fat foods. Consider working with a dietitian for a tailored nutrition plan. Thank you for watching the video until the end. If you enjoyed it, make sure to give it a like and subscribe to the channel for more videos. Thanks for your support.